Today, I'm going to be talking about Huntington's disease. First, I'm going to talk about the pathophysiology. Huntington's disease mainly affects a part of the brain called the neostriatum, which includes the caudate nucleus and putamen. In HD, these areas shrink and lose nerve cells, while another type of cell, called astrocytes, increases. Other brain areas, like the cerebral cortex, thalamus, and cerebellum, also shrink to different degrees as the disease worsens. There's different grades on how to classify the shrinking. Grade 1 is no major visible shrinkage. Grade 2 is some shrinkage, but the nucleus still has a rounded shape. Grade 3 has more severe shrinkage, uh, but the caudate nucleus flattens. Grade 4 is the most severe. The caudate nucleus becomes concave. Huntington's disease is associated with inflammatory destruction of brain cells that had previously been functional and healthy. The defective Huntington protein is believed to play a role in developing this disease. The function of this protein is not known for certain, but it may be involved in protecting brain cells from toxins. As you can see here, the Huntington's disease brain has much more shrinkage, and in some spots the holes are growing larger, so less brain mass. The risks for Huntington's disease are mostly hereditary. It is the only having hereditary is the only known cause of Huntington's disease. It is inherited in a dominant pattern. If a person inherits the gene that causes Huntington's, then the disease-producing gene dominates the other. The HTT gene is the gene that causes Huntington's disease and is located on chromosome 4, just like the picture. Every person inherits two copies of chromosome 4, one from their biological father and one from their mother. The genetic defect that causes Huntington's disease is described as a repeat in the HTT gene. This is a mutation in the DNA molecule. The mutation consists of a repeated pattern of cytosine, adenine, and guanine, which are nucleotides in the DNA molecule that code for the production of the body's traits. The majority of patients with Huntington's disease have 40 to 50 CAG repeats, with the normal number of repeats being less than 28. As you can see in the picture, the first green DNA is the normal amount of repeats that someone will have, and the pink has 40 plus repeats of CAG, which is not normal, and that is what they believe is what causes Huntington's. Now I'm going to be talking about the different stages of the disease. So stage 0 is the preclinical stage, stage 1 is the early stage 2 is the early intermediate stage 3 is the late intermediate stage 4 is the early advanced stage, and stage 5 is the advanced stage. So symptoms and treatments of each stage. Stages 0 through 2. Stage 0. Individuals do not exhibit any significant motor signs, and their cognitive and behavioral abilities are typically normal. But genetic testing reveals the presence of the mutation that causes HD. This stage is preclinical since individuals don't show any visible signs of the illness yet. There are really no symptoms since you can't really tell what's going on, and for the treatment, not really much is known in this stage, since the only thing that tells them if you have it is getting genetically tested. Stage 1, the early stage, is where motor signs finally become evident. Mild movement disorders characterize it. These symptoms are barely noticeable as well, and oftentimes they're dismissed as normal aging. Individuals may experience changes in mood and behavior, but again, people always blame that on just stress or other factors. Involuntary twitching, jerking movements, minor balance issues, and slight difficulties with fine motor skills, such as handwriting, are present during this stage. Also, cognitive signs like forgetfulness, concentrating, difficulty concentrating, and decreased processing speed. The treatment includes medications to manage their movement and psychiatric signs. Physical and occupational therapy may also be beneficial, and support groups. Stage two is the early intermediate stage, and this is a further decline in motor function and cognitive abilities. Individuals may have difficulty performing daily activities and they may need help with some tasks. The first symptoms in this stage are the motor ones. They become very pronounced and frequent. Balance issues become noticeable. It's difficult to walk, perform other activities, and memory loss also becomes extremely difficult. There's also behavioral changes such as social withdrawal, impaired judgment, and then the treatment includes medications again and therapies if you can, even because since there's no real way to cure this. Stage three is a late intermediate stage, a further decline in motor function, and individuals need significant help with daily activities, just like eating, dressing, and personal care. It makes it difficult to walk again. Balance is bad, memory loss, confusion, disorientation, aggression, impulsivity, and agitation. So it's more of the cognitive signs in stage three than it was in stage two. And speech therapy is introduced during this stage, since that's when that kind of starts to decline. And then hospice is also a treatment option since there is no other real cure. Stage four is the early advanced stage, a significant decline in motor function, and individuals are unable to perform daily activities without lots of help, and they may need full-time care. Individuals experience rigidity, communication becomes different, speech difficulties are really difficult, or speech difficulties arise. Um, Cognitive signs are very severe. They have difficulty recognizing familiar faces. Behavior changes may include compulsive behavior. Same treatment as before, medications if they can, speech therapy, occupational therapy, physical therapy, and then also having a full-time care. Stage five is the advanced stage, and it is the complete dependence on others for all daily activities. Individuals in this stage are often bedridden and unable to communicate. During this stage, all of the symptoms that I've said previously are just very severe and worsened, and they may even progress into a psychosis or a depression because they can't communicate or speak. And unfortunately, there is no cure or real treatment for this. Um, so you kind of just have to support them as much as you can. Now, what I was really interested in, um, when researching this topic was how Huntington's disease affects one's mental health, because I feel like these diseases that we talked about in class are very like physically, like you can see the physical signs more easily and they're more talked about and tested. But I was really interested in the mental health aspect. So, Huntington's disease affects mental health, um, ex extremely. And these mental health symptoms can appear years before the motor symptoms are even noticeable. But again, people just discredit them to other things. So, one thing that they can have are mood disorders like depression. This is one of the most common symptoms of Huntington's, since it's linked to the degeneration of brain regions that regulate mood. And it can persist into sadness, low energy, and suicidal thoughts. Anxiety is also a big one, since your brain is constantly fighting with this disease. Increased worry, panic attacks, obsessive thoughts, compulsive behaviors, which I talked about in the previous slide. And then irritability and aggression. Individuals may have mood swings and become easily frustrated, which makes sense when their brain is slowly but surely degenerating. Number two is cognitive impairments, which I talked about, difficulty with decision making, memory problems, impaired judgment. I kind of already talked about that. Three, psychosis and hallucinations. Some patients experience paranoia, delusional thinking. It's less common than depression and anxiety, but it could definitely still happen since parts of your brain are just kind of dying off. Social withdrawal and apathy, huge loss of motivation in social interactions, and this can also link to depression. Increased risk of suicide. It's much higher with individuals in HD, especially in the early stages, since they're aware of their diagnosis and they kind of know how the disease is going to progress, since it has no real cure. And then OCD, repetitive thoughts, hoarding, checking things repeatedly. That also goes in with not being able to remember things and having that part of your brain shutting off. And then why is mental health affected in this disease? Huntington's disease affects mental health because it causes progressive degeneration of brain cells, particularly in areas that regulate mood, cognition, and behavior. Specifically, the HTT gene, which I previously talked about. This protein gradually damages neurons, particularly in the following areas. Number one, basal ganglia. The basal ganglia controls movement, emotions, and decision making. With HD, this area shrinks, leading to mood swings, impulsivity, and irritability. Number two, the frontal and temporal lobes. The prefrontal cortex is responsible for judgment, impulse control, and planning, which is extremely affected with this disease. Damage leads to poor decision making and cognitive decline. The temporal lobe processes emotions and memory, which also is affected, which is what causes the depression and anxiety. Then number three, the imbalance of neurotransmitters. HD disrupts dopamine, glutamine, and GABA chemicals that regulate mood, thought processing, and movement. Uh, Excess dopamine early in the disease may contribute to irritability and impulsivity. So the imbalance of neurotransmitters lead to why they're impulsive and they have mood swings and they're just losing a lot of important neurons in their brain, which is leading to these mood swings and mental health issues. Okay, number four, the progressive brain atrophy. As the disease advances, brain atrophy spreads, worsening cognitive decline, emotional dysregulation, and psychiatric symptoms. So, kind of goes all in together. Many individuals experience these symptoms, however, years before, like I said, but they blame it on other things, which is an issue, and I think it needs to be talked about more that yes, you can have depression, anxiety without having Huntington's, but I think everyone who is gets diagnosed with um anxiety and depression should be tested for Huntington's as well and make sure that they don't have the gene because I feel like knowing earlier on could hopefully help in the long run. And that is it. Thank you so much for watching.